Welcome back. Well, dealing with a pandemic can take a toll on all of us. So imagine how living with obsessive compulsive disorder or being a germaphobe can create even more anxiety. Joining me right now with ways to cope while we all navigate through this uncertainty is Dr. Bendia Gandhi of Revive Atlanta MD. Good morning to you, doctor.
Good morning, Sharon.
Well, let's start off with how stressed so many of us are. And of course, there's increased anxiety and depression. How do we lessen the voices in our head?
Well, that's a very good question. Right now, a lot of us are overly cleaning and with good measures, but that's unfortunately causing a lot more OCD tendencies. We're washing our hands excessively. Maybe we're afraid, could we be getting some bacteria on us, or could we be spreading the virus or that kind of thing? Now, cleaning and washing your hands and disinfecting is all good, but there comes a point when it can become excessive. What I suspect is going to happen is we're going to start noticing that there'll be some antibacterial resistance that'll eventually happen. Because we're cleaning too much, the bacteria may form some resistance. And so we're probably going to need to get some additional, antibacterial disinfectant solutions, that kind of thing. But there's a lot more anxiety right now, a lot more depression, a lot more paranoia. Everybody's paranoid about being in public, about their personal space. Should you wear a mask? When not to wear a mask? It's causing a lot of havoc. I mean, mental health right now is a big thing.
So I guess when all of this is going on, it's probably a time. When do you know that there's a time that you probably need to seek help?
Honestly, if you start noticing that your behaviors are changing, you start noticing that you're, developing fear of going out in public, you start noticing that you're washing your hands like every 2 minutes, you start noticing that you're cleaning every few minutes. If you start noticing that you're a little bit more depressed, you start noticing that you're having weird thoughts or abnormal behaviors where you are starting to have thoughts about maybe hurting yourself, or you used to have thoughts about just negative thoughts in general, you need to seek help. Talk to your primary care doctor. Definitely talk to family members about this, because there's help and we need to pay attention to this.
And doctor, can you leave us with some closing thoughts for anyone who might be finding themselves in a situation where they're just so stressed out?
Yeah, honestly, the biggest thing that I want to mention is it's very important to stay clean and to be protective. Remember, we're still social distancing. We want to make sure that we're, keeping 6 feet apart. We want to make sure that we're doing all the things that we're supposed to according to CDC guidelines. But at the same time, we want to make sure that we're also paying attention to our mental health. So a lot of things that we need to start doing, if we're not doing already, is, look into mindfulness, meditation, breathing techniques, journaling, a lot of positive things that can help our mental health, because that's important.
Dr. Bendia Gandhi, thank you so much for joining us with that.